Hey, my name is Amy Thompson. I'm a physical therapy assistant here at RMC. I'm going to give you a little instruction about what will happen after your surgery. When you have your surgery and you finish in recovery and you come to the orthopedic floor, within 2 hours or so, you will be seen by a physical therapist and an occupational therapist. They will go over things there with you as far as checking your range of motion, your strength, and get a game plan for you for while you're here in therapy. After that, depending on the time that you have your surgery, you will have another therapy session that afternoon. If not, then you will see us again the next morning. Occupational therapy will come in the next morning and get you dressed for the day. They will help you with your daily activities, such as dressing, bathing, freshening up, and then you will come to the joint camp classroom where you will see me and we will go over the exercises there. That's what we will do next. We will be demonstrating those exercises for you. So what we'll be doing now is we're going to go over the exercises that we will do in your joint camp class. When you come to joint camp, you will get these two pamphlets. One's for the hip and one's for the knee, depending on your surgery that you have. And it gives you all the information that you need, plus the exercises that we're going to be demonstrating today. The first exercise is ankle pumps. You're going to pull your toes back and point them back and forth, just like you're tapping your toe. This exercise is beneficial. It works the muscles in your leg and in the lower part of your leg, which helps decrease any swelling that may be developing. It helps increase the blood flow, which will help your healing process. The next exercise that we're going to do is heel slides. And you're going to just take your heel and slide it back as you bend your knee, bend, and then straighten. This works the muscles in the top and the back of the leg, which is your hamstrings and your quad muscles. It helps get the bend in that knee, especially if you've had the knee surgery. It works on getting that motion back. The next one is short arc quads, which works the quad muscle. Your quad muscles are the muscles up in the top part of your thigh. Those muscles after a knee surgery especially are very weak, so it's very beneficial for us to get those muscles stronger. This exercise, you keep your knee on the towel roll and you're going to pull your toes back and extend that knee straight, keeping the knee on the towel roll. And that is working this quad muscle up here. There we go. We're going to do hip abduction. That's just a fancy way of saying slide your leg out to the side. You're going to pull your toes back, keep that knee straight, and you're going to slide your leg out and in. This one is going to work the outer hip muscles, your abductor muscles, which is going to be beneficial for our hip patients because that is right where your surgery site is. And it's going to help strengthen those muscles so you'll be able to have a better walking pattern and stand up straight. Okay? So the next exercise that we are going to do is a straight leg raise. This one is very beneficial for you to practice on pre-surgery because it's working all of the muscles in the leg, so it tends to be a little difficult after surgery. So the more you work on it before, the easier it will be afterwards. What you're going to do, you're going to bend your opposite knee. You're going to lock this knee straight, pulling your toes back. You're going to extend the leg up. Raise it straight up. Don't go past this knee. And then bring it back down. That again really works that quad muscle also. The next exercises that we'll be demonstrating are our standing exercises that we do in joint camp. These exercises are very similar to the ones you do laying down, but you're in the standing position. The first exercise that we do are called heel raises. And all you're doing is going up on your tiptoes and then back down. Nice and smooth and slow. The next exercise is called mini squats. You're going to have your feet about shoulder width apart. Now this is a mini squat. A lot of people just think that they have to squat really low for this, but you don't want to do that, especially after surgery. All you're going to do is just very gently, slightly bend your knees and then come back up. It's a very tiny squat. And up. The next exercise is called hamstring curls. You're going to take your surgery leg, you're going to bend, and then bring your foot back flat. All of this motion is done in the back part of the leg. You're not bringing the leg forward, it's all in the back of the leg. Those are hamstring curls. All right, the next one, we're going to turn and face the front. It's called hip abduction. We did this in sitting earlier. Now we're going to do it in standing. You're up nice and straight. Your toes are facing the front. You're going to take your operative leg and take it out to the side and bring it back in. Out and in. All right. The last standing exercise that we do is called marches, hip flexion. This is where you bring your leg up to the front. You're going to bring your knee up toward the bar of the walker there. Up, as if you're marching, but you're just going to do it on your operative leg.